I'd love to take some questions or hear your comments or your ideas.
Yeah, how do you turn around that perception of these King County Democrats about Republicans over there? Because you've been going door to door, so I'd be interested in how that doubtingness of, you know, Republicans having a heart or caring about other folks' situation, how is that going to be turned around?
Well, this is a two-part answer. Part number one is, I think our party has a lot of work to do, and it's a grassroots thing that's going to take many years of overcoming this issue and reaching out to people. And frankly, as a party, we haven't done a good enough job, either nationally or at the state level. So anything that we can do to reach out to people, maybe as Republicans doing more volunteer work in our communities as a party, maybe we take on projects of helping people in need in the community in some way, helping them keep their yards up, if they're widows, you know, what have you. I think that's one way, but that's going to take a really long time, and I think we need to take that work on as Republicans if long term we want to be consistently successful. I also think, though, that in my particular case, this election cycle, I think who I am as a person is going to be a very important issue. Unlike Mike McGavick, who ran against Cantwell 6 years ago, I am not the CEO of Safeco. I don't have that corporate image. I'm not part of corporate America. I'm not wealthy. I've worked very hard for what I have in my life. I lost my father when I was in high school. I couldn't go directly into college, even though as a young man I knew I wanted to be a medical doctor, and I knew I had to go to college first so I could go on to medical school. So I worked for 4 years after graduating from high school to help support my mother and my two sisters. My younger sister went to college ahead of me, and she got her degree in clinical psychology and went on and got a PhD in it. Now she's on the faculty at the University of Tennessee in psychology. And I worked 4 years full-time, gave all my money to my mom, and started going to night school at a community college, Bellevue Community College, during that time, and studied math really very diligently. And then I transferred to the University of Washington, enrolled in the honors program, had scholarships that paid my way. My mother did not pay my way. And I worked during vacations and summers. One summer I was working a day job and a night job to earn money to help pay for it. And went on to medical school and had some scholarship money and borrowed the rest, and so did my wife. We went to medical school together, and we paid off our loans early and lived very frugally to do it. I drive the first car I've ever owned. Bought it in 1993 after graduating from medical school, and it's the only car I've ever owned. So I think my life says something, but more importantly, my work in medicine, where I do home visits for the seniors, the disabled, and the very poor, and those without insurance, I think is a powerful message to people who consider themselves compassionate voters, caring voters, who want to see people who need it helped. And, you know, Barack Obama and Maria Cantwell and Harry Reid and Patty Murray and those types can play doctor on TV, and they can tell you how much they care. I am a real doctor, and I have proven for years how much I care. And in order to see my patients, in order to see patients who pay so little for my services, I had to close my office and go to a home visitation model. So I just do home visits now. I don't have an office where people can come to me. And I've gone without malpractice insurance for years because it's very expensive. And if I paid the price for malpractice insurance and an office, I wouldn't be seeing these folks. But I'm willing to take on that personal risk to do it. I think this is a powerful message that voters in Puget Sound are going to like. And I'll tell you something. Last weekend, I was really honored to be one of the 2 keynote speakers at the annual meeting for the Washington State Neurological Surgeons Group. Now, I'm not a neurosurgeon, I'm a general practice doctor. But they invited me because they were really excited about the fact that a doctor was running for the U.S. Senate. And they asked me if I would speak on how it is that I decided to go from being doctor to running for U.S. Senate, and also talk about healthcare policy. So I did that. And one of the neurosurgeons there, he just happens to be the chief of neurosurgery at the University of Washington, Dr. Richard Ellensburg, came up to me after dinner Saturday night, and he said, "Art, do you have a donation envelope?" I said, "I do." Give him an envelope. He sits down, he had all of his colleagues around the table, he's writing it out, makes a nice, generous donation, and hands it to me. And I said, "Well, Dr. Ellensburg, thank you very much may I also have your endorsement? And he said, absolutely, you have my endorsement. But I need you to know this, Art. I'm a Democrat.
But will he vote Republican?
Here's what he said. So good question. So he went on to explain. He said, Art, I'm a Democrat, but you know, I just think I should vote for the best person when you're in. And I think this is the winning thing. I think we're going to win in liberal Puget Sound. We may not get over 50%, but those folks are looking for authenticism. They're looking for leadership. They're looking for the know-how to actually fix the problems in Medicare and Medicaid. It means a lot to them. And that's one reason they've been voting for people like Patty Murray and Maria Cantwell all these years. But now they've got a reason not to. So I'm very excited about this. I want you to be excited about it. I think it's a winning year for us. And I'll make another comment. We've had a lot of focus and attention on the presidential race, and we should. We must have a Republican president. But think about this. What if we have a Republican president, but Maria Cantwell stays in the Senate, and the Democrats have 51 votes? Our Republican president needs to nominate justices for the U.S. Supreme Court, possibly 2 of them in the next 4 years. Blocked. He wants to appoint judges to other federal benches. Blocked. He wants to do all sorts of things. He has the House, but the Senate blocks him and blocks him and blocks him and blocks him because Harry Reid and company are still in charge. They're in charge of Capitol Hill, folks. So it is crucial that we win the Senate seat. It is absolutely crucial. So don't forget that when you're thinking about how you're going to, disperse your time and money and energy supporting candidates. Support our presidential candidate, but also I'm asking for your support so that our president can get the work done that he needs to. And God forbid if Barack Obama does get reelected, reverse it. He's probably going to make a couple of Supreme Court appointments. Is anybody in this room happy with Elena Kagan and the other one? Anybody here happy with those? Sotomayor? Imagine 2 more. Imagine that. Yeah.